The most important thing to know when you're discussing the urinary tract infections is their presentation, which is obviously the symptoms. So symptoms can be there's a widespread range of symptoms when you come to the urinary tract infections. So actually, there are symptoms which are categorized as obstructive symptoms, and there are symptoms which are categorized as irritative symptoms. So obstructive symptoms are, because of maybe it's a kind of a bladder outlet obstruction, or it is a ureteric obstruction somewhere because of the stone. And the irritative symptoms are mostly secondarily to the infections anywhere, maybe in the lower urinary tract or in the upper urinary tract. Now you need to differentiate what are the symptoms in obstructions and what are the symptoms in irritation. I'll be explaining these symptoms one by one because they are technical terms and they need to be understood nicely and easily and clearly. So hesitancy is a symptom which is most of the time related to the obstruction. Right? It's not the irritative symptom. So what does hesitancy mean? Hesitancy means that the patient has a kind of an urge for micturition, but when he goes to the bathroom, he sits in the commode and he waits for the reflux to generate. It takes a lot of time, so there's a delay. He is feeling the pressure, he's feeling the urge to urinate, but there is a delay in the start of the urine, right? So he's hesitant to stream. So that is actually called as hesitancy. So most of the time it's more common symptoms of the bladder outlet obstructions or ureteric obstructions. Then straining. What does the straining mean? That he's sitting and he's trying to urinate, but he has to put a lot of strain. What normally happens is like you go to the bathroom, you sit, you make a proper position, then there's a reflux generated, and immediately the stream comes out. But sometimes there is a hesitancy, and initially it takes a little while to start with the urine, and then there is a straining. To pass the urine, you have to push, you have to strain. That's called as a straining. So hesitancy and straining, these are the obstructive symptoms, we can secondarily to the bladder outlet obstruction or because of ureteric obstruction. Weak flow. By the weak flow means the stream of the urine. So it can be a thick stream, it can be a thin stream. Normally when a person knows, most of the time knows about the habit of the stream, it's a thin stream or a thick stream. So if he's passing too thick stream or too thin stream, it depends, and he can, in most of the time in obstructive symptoms, along with the hesitancy and straining, there is a weak flow or there is a thin stream of the urine. Terminal dribbling. So what do you mean by terminal dribbling? It means that the patient has done passing the urine, and after he thinks that he's done with active urination, but after the end he passes few drops of the urine. That is called as a terminal dribbling. Then prolonged voiding. That means that he is passing the urine, but it takes a little while because there are breaks. Then he starts passing the urine, he starts for a while, then it stops, then there is a pause, then he starts over again, then stops, then there is a pause, so he's not passing the urine, or it's not voiding in a continuous manner as we normal people do, but he's actually passing the urine in chunks, or you can say it's a prolonged voiding. Then sometimes there can be urinary retention. Patient, if the obstruction is somewhere the narrowest part, like in a vesico-ureteric junction, which is a VUJ junction. So at that point, there is obstruction secondarily to the stone. Then the patient will present to you with a urinary retention. Sometimes those aged people, especially the males, they have benign prostatic hyperplasia or prostatic cancer, and that obstructs the outflow. So that's actually obstructing the outflow, and because of that, there is retention of the urine. So it's also the obstructive symptoms. Overflow incontinence. That means that he has no control over the bladder, and whenever his bladder is full, instead that he he has the control, and he can control his voiding, or he can control his urine while he finds a good safe place for urination. But there is overflow incontinence. So whenever there is, the bladder is full, it passed on its own, the reflux is lost, and especially the control reflux is lost. So remember, hesitancy, straining, weak flow, terminal dribbling, prolonged voiding, retention, and overflow incontinence. These are all the symptoms which are related to the obstruction. So obstruction can be anywhere. It can be in the ureters, it can be in the bladder, it can be secondarily to the benign prostatic hyperplasia or because of the stone. And then it can be anywhere in the upper, middle, or the lower poles of the kidney. Hesitancy is the patient is hesitant to start the urine. He's sitting, but it's taking him a while to start passing the urine. Straining is like to urinate properly. He has to strain a lot. Weak flow is thin stream. Terminal dribbling is the term which is used when he's done. He thinks he's done with the urine, but he's still. There is a few drops of the urine are being passed after he finishes the act of urination. Then prolonged voiding, then retention, and then overflow incontinence. These are all the obstructive symptoms, and they're secondarily maybe to the bladder outlet obstruction, maybe because of benign prostatic hyperplasia, because of the urinary stones anywhere in the upper or the lower urinary tract. Now, when you talk about the irritative symptoms, so most of the time, these irritative symptoms are related to the urinary tract infections, the upper or the lower urinary tract infections. So frequency, the patient has urge to go to the bathroom again and again. So his frequency of voiding has increased. Then its urgency, whenever even there is a minimal filling of the bladder, but still he feels that he urgently needs to void. He cannot control, and he urgently feels to go to the bathroom and void. That is called as urgency. Nocturia means that the patient is sleeping and he has the urge to go to the bathroom while he's sleeping. Urgent continence is again is the irritative symptoms, and it's like because he is feeling urgency and he could not control, and there's a passage of urine, so that is called urgent continence. There are small voided volumes, so these are also the irritative symptoms, and they can be accompanied by the pain. What you need to differentiate is the site of the pain. So when you talk about the lower urinary tract infections, the pain is usually in the groin. It's radiating to the to the length of the urethra or ureter, and then it's actually going in males. It's actually going to the genitals. But if it's pyelonephritis or upper urinary tract infection, the pain would be more on the flanks, and it may be radiating to the back, and there can be there is a positive renal punch, which we call is a costovertebral tenderness, is positive in these patients. One category is like they divide these symptoms, and obstructive and the irritative symptoms. The other category is like the void and storage, like storage symptoms. Then you have the irritative symptoms, and storage and irritative symptoms are most of the time they're same. And then you have the obstructive symptoms, and then you have the post-voiding symptoms. So the post-voiding symptoms are like maybe post-voiding dribbling, and these are because of the bladder outlet obstruction, or because of some neurogenic bladder and stress incontinence as well. So you need to investigate your patient, you need to investigate his symptoms, and you need to figure it out if the symptoms are more on the obstructive side or more on the irritative side. It's not always the rule that the patient would have obstructive or irritative syndrome. They can be together, okay? So there's a possibility, there's obstruction, but there is accompanying UTI as well because of the obstruction, or there is UTI, and because of that there is a stasis and there is crystallization of urine, and then later on there are concretions, so they can be together, obstructive and irritative symptoms. But for if there is a chronic pyelonephritis, or there's a chronic complicated UTIs. So these symptoms can happen together. But most of the time, ask your patient, probably look for if they're more on the obstructive side, more than the irritative side, and then you have to treat your patient accordingly. Obstruction would be dealt with, obviously, cystography, or you have to do the obviously you need to cystoscopy, or you have to go for the lithotripsy, depending on if there's a stone. And the irritative symptoms, they can be because of the infection, so you can treat them with the proper antibiotics.